Now, my next guest is a supporter of Obamacare, and he argues that governments should provide health care in the same way as they provide free water and free education. Alex Marshall is a senior fellow at the Regional Plan Association, columnist and author of the new book, The Surprising Design of Market Economics. Alex, thanks for joining us.
Great to be here, Michelle.
Alex, in your new book, you make the argument that a couple of centuries ago, water and education were seen as private responsibilities. Now the government has taken over them for a while. We take it for granted, and that the same should be applied for health care. Quickly elaborate on that.
Exactly. If you look at the arc of history, it's for government to do more and more, and that this is good not only for people, it's good for business. I mean, 100 years ago or 150 years ago, people argued that people shouldn't have basic education, that that's a private responsibility. They even argued that with water. They said, why should I have to pay for my neighbor to get a glass of water? Why should I have to pay for my neighbor to educate his children? But we had that argument, and the side that wanted to have public education and public water won. And what's the result? The result is that we're all a lot better off. Now,
however, the trend is that once the government steps in and controls it, the quality seems to decline. And let's take education, for example.
I beg to differ.
Well, hear me out here. I'm going to play devil's advocate, and let's take education, for example. You have taxpayers who pay for public schools, but the quality of most public schools is not up to par if you want the best for your child. So on top of those taxes, you have to pay for tutors or for private schools, and you've got the lower middle class, upper middle class being hit twice. They're paying for taxes for schools. They have to still pay for private schools. And the rich, they can afford it. The poor, they benefit. But it's that upper middle class, which is the backbone of any economy, that's really just getting hit twice.
Oh, 2 points, Michelle. First of all, my son goes to public schools, PS 39 in Brooklyn, and he's educated very well. I think the public school's a nice one. But two, just even conceding some of your points, do you want people to walk around and not be able to read? I mean, is that the kind of society you want to live in? I mean, would that even be good for you? I mean,
well, let's take it back to health care.
Okay.
And the Association of American Physicians and Surgeons, they say that Obamacare will significantly increase overall costs, that you're going to have, it's not good for the economy because businesses are going to have to pay more. And they say that it will reduce the quality of care that, quote, a free market system would otherwise provide. What's your argument to that?
Well, there's no free market in healthcare. I mean, first of all, as I say in my book, The Surprising Design of Market Economy, all markets are constructed, really. They're all built by government. But healthcare is one of the most elaborately constructed. So it's not as if it just sort of exists without government right now. But, you know, I think ultimately we will all be better off if everyone can get health care. I mean, ultimately we are better workers, we are better employers, we are better employees, you know, if we're not sick. And, you know, it's just everyone benefits in the long run. And I think ultimately costs will go down.
I'm not advocating for illness for the general population. I'm sure neither are the Republicans. But the fact of the matter is Republicans argue Obamacare will impose massive penalties on young workers, on small businesses, and others who choose to not buy expensive health care plans, and that it actually disincentivizes businesses from growing bigger. So how is that good for business?
It's good for business to have their workers covered. And that's partly how it's good. It's also good for business to not have to pay all the cost. And that's part of Obamacare.